And while we're talking about eye damage, it gets me thinking about red light devices.
Mm.
And I actually have two different brands in the house. One of them recommends looking into the device, the other provides goggles to cover your eyes, making sure you're not exposing them. So, talk about that. How can we have both ends of the spectrum there?
So, red light and eyes is quite fascinating. I think it's an area of study that one of the reasons why some devices will say, hey, wear goggles, it really has to do not only with which specific wavelength that device emits, but again, it's all about the power density. And then there's also the distance from the face, distance from the eyeball, and then the time of exposure. There's multiple factors. And I hate to say, but this area of research around the eyes, I know the skin, it's been around for a long time, but around the eyes, we don't fully understand it yet. And the eyes, especially the retina in the back of the eye, is so sensitive and delicate that if you give too much power to it, too much density, you can cause phototoxic or photochemical damage to the retina, or there could be heat and you could elevate the temperature inside the eye, and that can cause permanent damage to the retina too. We do know, so just recently here in the United States, we got FDA approval for the Valida light system. This is a red light therapy type device that will become available to eye clinics to specifically treat macular degeneration. And I've been really excited about this technology. It's been available in Europe and some places in Latin America for a few years now. But this device doesn't just emit red light, it actually emits red light, near infrared light, and then some yellow light. And it alternates with your eyes closed for one part of it, and then have your eyes open for another. And it alternates back and forth for about 5 minutes. And you do this about 3 times a week for like 3 weeks, and you repeat it a few times a year. And the major clinical studies found that with this treatment, not only is it slowing down the progression of the disease macular degeneration, but it reverses deposits of this protein deposit that builds up in that condition. But then it can even give eyesight back. It can restore visual acuity for a lot of people with that condition. So it's honestly pretty. I think it's pretty profound research. That's with that specific device, though, because other devices, because of this FDA approval, are looking into it. Hey, does this other red light device that's being used for like dry eye or skincare, for example, does that also have the same effect? And they're finding it doesn't, or if it does, it's a very minimal effect. So it really depends on the wavelength. It depends on the power density, and then again the other factors of like how often, how long is it being used. And I wish I had the exact answer to break all that down with certainty. But again, the research, as I've been digging into it, it just doesn't seem super clear. It seems like we're discovering things that they work, but we don't fully understand all of the extreme parameter changes.
So, it sounds like it, but as of now, you're not looking into any red light devices at home or in your clinic other than this one that's been approved.
So for at home, there are several devices that are on the market, but usually they're sold from outside the United States. There's one from Canada. There's another one from Europe that have these companies. Either I've reached out to them or they've reached out to me. And so I have two devices here at home. The challenge is that while they are marketed for being beneficial to the eye, there still remains this question, like, do they really have an effect? Because I could be using it and feel like it's helping, but I'm not finding any objective changes to my eyesight. It could just be placebo effect. I'm still kind of myself like questioning, is the power density enough? Is the power density what the manufacturer even says it is? Because there are also some publications that have shown some of these manufacturers, even though they'll claim the power density is one thing, when they do it in third party testing, they find that it's not. And so I'm being very cautious myself about before I start making any claims or before I start recommending any specific device to my viewers, listeners. I think it's very early on. So at the very least, if you are using a red light device for your skin or for other health benefits, if it recommends wearing eye protection, then I would definitely continue wearing eye protection for now.
You only get one pair of eyes.
That's true. Although we did have the very first eye transplant the other year that was successful, even though successful in the way that the body didn't reject the organ. The recipient of this donor eye, unfortunately, does not have usable vision. But just the fact that they were able to get the eye transplant fully and him not reject it was kind of a medical marvel in a way.
If you enjoyed that clip, you're going to want to head over here and catch the full episode. I'll see you over there.
Diabetes affects the eyes significantly. Not only does diabetes increase the risk for things like cataracts, diabetes affects the blood vessels throughout your body. And the retina in the back of the eye is one of the most highly vascular organs in your body too.